Welcome back to Chamber Connect. I'm your host, Deb Newman, President and CEO of the Bangor Region Chamber of Commerce. And today, we're going to be talking about an organization that has been serving the Bangor region and probably well beyond for a few years now with Dale Hamilton. Dale is the Executive Director. The organization is Community Health and Counseling Services, also known sometimes as CHCS. Welcome.
Well, thank you.
Thanks for joining us.
Absolutely.
I first want to recognize that Community Health and Counseling Services was just recognized as the Nonprofit of the Year by the Bangor Region Chamber of Commerce at our annual awards event in April. So congratulations.
Well, thank you, and thank you for the award. We certainly appreciate it, and the staff of the organization, well deserved for them.
And I think it was, absolutely well deserved. I think it was a great opportunity for the community to learn more about the work that you do. Because many of us may be familiar with community health and counseling services, but really not understand the depth and breadth and scope of everything that you offer in this community.
I think that's true. It's one of the types of services we provide aren't always identified in the community unless you have a need for that particular service. And so anytime we get a chance to talk about what we do, it helps the community to know the resources we have available in case they have that need at some point.
Let's go back to the early days, and we do want to talk about all of the services you provide, but this organization has been around for a few years.
It's been around since 1883.
What?
So it's and the reason we know that is that when it started as a volunteer organization. So a group of church women from multiple churches came together to say that let's work together to meet needs in the community. And so that's exactly what our mission is now. The service array is different, obviously, but the same goal of meeting needs in the community remain. They kept their documents, and what's great is that we were able to, I think probably 10 years ago, bind all of that material from 1883 into the late 60s, and the Bangor Public Library now holds all those documents because they have a lot of historical significance for this area. So
that is really cool. And in fact, I'm just looking at your website, which is a great website, chcs-me.org, and I'll just read this. For the first decade, the Board of Lady Visitors carried out all the work of this organization. Because of the systemized approach to relief, the local community called upon the associated charities to collaborate and coordinate aid for events like the Great Bangor Fire of 1911.
Yes.
The Spanish influenza epidemic of 1918, the Halifax Harbor explosion in 1917, and local World War I relief effort.
Yes.
Wow.
It's got a great rich history, and today we deliver different types of services, but still try to meet those needs in the community. And one of the really neat things is St. Mary's was a part of that initial group of churches, and our location in Bangor is the site of the St. Mary's where the church used to be, and we were able to, when we acquired the property, bring together the convent and the school, add on and connect that. So we kind of have that, not only the history in the community, but also that physical history is still part of us.
And it just speaks to an organization continuing to find ways to serve and to remain relevant.
Yeah, I think so. And I think, that's really our mission. Is the mission of most nonprofits is to meet those needs in communities and be creative, innovative. And that's what we try to do is in the areas that we serve behavioral health services, home health care, hospice care, and a lot of different types of social supports, for lack of a better way of describing those services. And as I said earlier, we provide such a broad array of services that it's hard to always be able to describe everything that we do.
Yeah, and you did a great job because you know it better than anybody else. How do people connect with you? Is it through provider referrals? Is it through direct outreach?
Yeah, that's a great question. It really does depend on the type of service that a person is in need of. So, for example, our home health hospice, typically those referrals are made through primary care providers or hospitalists. It's somebody that's already connected, because those services are for individuals that are experiencing an illness, an injury, recovering from a surgery, and hospice at end of life. So we get those referrals directly from that. In behavioral health, it's a variety. Individuals refer themselves, other providers refer family members. So it really, we receive referrals from lots of different sources. And one of the things that I always talk about is, if you don't know where to go for services, that can be one of the services that we provide, is to help you get to the right place. We don't deliver it. We probably know a place that does, and we will help you to get to the right location.
Because sometimes navigating healthcare services and systems can be complex and complicated, especially if you're in a stressful, urgent situation and you need help.
Absolutely. And the healthcare system in general is that there are lots of specialties. There's lots of different types of services, and generally people don't know what those are. And you might know a little bit of a system of care, and you might think, okay, if I have a behavioral health need, if I have a need for that type of service, I might think of therapy, and that's why I'm reaching out. But there's a whole host of other services that people just generally don't know what those are. So just reach out. That's the most important thing, is when you identify that you have a need for healthcare support, that's the time to act on it. Don't hesitate, call us. We think that that's the most important part, is that first connection, because that's when people are looking for services, that's the time to connect them to the right resource.
We all know that healthcare is facing a lot of challenges right now. How are you navigating through all of that so you can continue to provide the services that you want to provide and that are needed?
Yeah, I think there are many challenges in the healthcare system, whether it's funding. We hear a lot about that.
Yeah.
I think that's an ongoing challenge, and will be an ongoing challenge. It certainly is part of our history. But the other part of it is just having the people resource. We've seen that's in all sectors. We know in Maine, we're an aging state, meaning that we have more people exiting the workforce than entering. So what we have to do is, I believe, especially in healthcare, is become more innovative. Look at ways of getting services delivered in a different way, so that we can serve more people with fewer resources, be as effective in terms of the outcomes. But we really need to challenge ourselves, because a plan of just hiring, being more creative in terms of putting out advertisements and trying to recruit in, isn't going to solve the challenges that we face around workforce. So I think that is, cost is certainly an issue, but I think workforce is the larger issue that we all in healthcare have to address, and innovation is what's going to, I think, solve that.
So if you're looking for a great place to work, you have open positions.
We have open positions. We encourage you to go to our website, give us a call. It's right on the website in terms of our number. We have lots of different types of positions. We have entry-level positions. If you are looking to see what's available in this field, we can provide those types of opportunities. We have part-time, full-time. We're very flexible in terms of working with individuals and trying to match people with what they're interested in.
Yeah, it's all right here on your website. It's very well done. CHCS-me.org. How long have you been the Executive Director for Community Health and Counseling Services? And again, if you're just tuning in, we're speaking with Dale Hamilton here on Chamber Connect. How long have you been doing this?
So I've been with the organization for 33 years, and I've been in this role as Executive Director for 16.
Wow.
So not quite all the way back to 1883.
No, quite.
At times it feels like it.
Sometimes, I guess I have one word question. Why?
It's what we do. It's the opportunities in terms of within the organization to make a difference, and the various roles I've had. Every step, every opportunity has produced that the ability to say, boy, we make a difference. There's something here. it's been such a great organization. And I say that when I wasn't in the role of executive director, it really, everybody shares that mission in terms of really making the community better by providing the services that are needed and focusing on the people that we serve. And that goal is something that we always keep reaching for. And I've always found that as a challenge to make us better. And it's just been a wonderful organization to be a part of.
And you have an incredible group of people working there. How many employees do you have?
We have close to 400.
Wow.
It varies from time to time, but roughly that number, not all full-time, a combination of full and part-time. We have foster parents who work with us through our therapeutic foster care program, so they're absolutely a part of the organization. We have volunteers who support the organization in various ways. So, and to your point, the organization, it is about everybody. Everybody has different roles, but we're all trying to accomplish the same thing. There's no role that's more or less important than another. Everyone's just focused on making sure that as an organization, we're able to meet the needs of the people who come to us for support and to be able to provide the very best care we can.
Then you mentioned home health, hospice, mental health, children's clinic, foster care, variety of services that you're providing. In the time that you've been with community health and counseling services, what have you changed in terms of the need for services? What have you seen change, rather, in terms of the need for services?
You know, I think the biggest thing that we've seen is more of an awareness of the services that are needed by the community. I think there's a better recognition that when I first started, perhaps there was less of the people that needed the service recognized it, but there was more of a stigma, especially when it came to mental health services or substance use disorder services. And so that prevented some people maybe from reaching out. You know, if anything, the pandemic did from a positive perspective, I think it really helped everyone to recognize that mental health, mental well-being is so important. It affects everyone. And if there's one thing that I can say that would help to change continue that change, is that what we deliver is healthcare. Mental health services, substance use disorder, it's healthcare service. And people shouldn't feel any kind of stigma. If you have a need for healthcare, whatever it is, seek that out. And so that's really been a positive change that I've seen, is just that recognition of that healthcare is healthcare. And I think more people are accessing it. Unfortunately, we're also seeing in some areas a growing need with some of the services that we provide. We know everybody in this community certainly sees it, is that there's a growing housing shortage that is leading to more issues with people experiencing homelessness. And so we're finding that that's increasing, and that needs to be met, and we need to figure out a way to help individuals to move into housing. So there's been some changes there as well.
One of the things that I think we're very proud of in this community and in the Bangor region is how providers do work together and partner together to find solutions to these challenges.
It's critical. As an organization, that's one of the things we talk about all the time, is we might not have the resource to meet a need. We don't want to just put people on wait lists and say, wait for us. What we want to do is get people connected to the service that they are requesting. So if you don't have those partnerships, then you're not going to be effective in getting people to the services that they need when they need them. So that's really important. The other thing is that sometimes you're not the right provider.
Right.
That you have the service, and you have to be willing to recognize that. If we're not helping someone, then let's get them to somebody that can do that. Those partnerships are incredibly important. No one organization can do it all. No one organization can meet all needs, and we're stronger as a community when we are working together. And I agree with you. I think we have a very strong commitment in this community to do that work.
Absolutely, and thank you. We have about a minute left. Is there anything that we haven't talked about, Dale, that you want to be sure to get across?
Well, I would just say that if in those areas that we provide services, look at our website. If you want to learn more, it's always best to be informed about what services exist before you might need it or before a loved one might need it. give us a call. We're happy to talk with you about that. It's really hard and difficult when you're facing an immediate need if you don't know what those resources are. So give us a call. We're happy to talk with you about that. If you have an interest in being involved in the organization in any way, by all means, give me a call. I'm happy to talk with you, and we appreciate the support.
Well, thank you for all you do.
Well, thank you.
And thank you for sharing that with us here on Chamber Connect.
Sure. Well, thanks
It's
for
a
inviting me.
pleasure to have you here, Daryl Hamilton. Website is chcs-me.org, or you can just Google Community Health and Counseling Services and you'll find them. Thank you again.
All right. Thank you.
And thank you for listening to Chamber Connect. I'm your host, Deb Newman. We'll catch you next time.